Hello there, my name's Pip Brennan. I'm from the Health Consumers Council, and I wanted to give you an update on the Sustainable Health Review. That's our statewide reform. It's focusing in on recommendation 4, which is about citizen and consumer partnership. So it does also touch on a few other recommendations. Recommendation 11 looks at outpatients. 13 looks at frequent presenters to emergency departments, and recommendation 25 is around digital health. So I suppose for me that's a perfect example of recommendation 4 underpinning most of the work, if not all of the work of the Sustainable Health Review. So let's just have a quick recap. So the Sustainable Health Review, the report was released in April 2019 after about 18 months work, and quite a bit of consultation created the 30 recommendations. You can see 15 of them here on the screen, and 8 enduring strategies. You can see 4 of these. You can see that recommendation 4 has been highlighted there, citizen and community partnership, and it's relevant to every enduring strategy and every recommendation. This is the next lot of recommendations. So there is going to be information, little videos about all of them being released one by one, but we're starting with recommendation 4 as one of the key ones. So when the Sustainable Health Review report came out, there were, as mentioned, those 30 recommendations, and each of those had milestones. So recommendation 4 has got 5 milestones, and you can read those there for yourself. I won't read them out to you. I guess I just wanted to highlight that you can see above M15, M9, M161, M56, and M84. So those are the milestone numbers that have been allocated. Because this is a really big, comprehensive piece of health reform that cuts across absolutely everything you can think about in healthcare, trying to track all the different recommendations and activities is quite a piece of work. So things have started to get coded. And you know what it's like once these recommendations start to get a bit more flesh on the bones and start to be implemented, sometimes these reference numbers can be quite handy. So I wanted to basically provide a bit of a resource that shows those. So digging down a little bit more, you can see here there are 3 different activities under that first recommendation 4 milestone, otherwise known as M15. So there's those 3 ones there, conducting a detailed review of current approaches, literature review, and co-design packages of new approaches. So just wanting to show you there. And again, I just want to raise your awareness of the R4A1 and R4A2 and R4A3. So that's recommendation 4, activity 1, and so forth. Again, it's just one of those things, just to help you sort of see how this sort of big network of work is coming together. So recommendation 4 milestone 2, otherwise known as M9, has these 5 different activities. So there is a copy of the PowerPoint. You don't need to, try and write these down or anything like that. I'm assuming you can read those for yourself. Just wanting to move through them one by one. There's this next milestone, recommendation 4. For some reason, there's M161, expansion of care opinion and so forth. So that's around transparent reporting and patient-reported outcome measures and patient-reported experience measures. It's obviously a really important area for changing things for consumers. Recommendation 4 milestone 4, aka M56, so increased public participation in major public health issues. Again, you can see that, see them all listed there with their R413s and so forth. And the last one was people accessing care closer to home. So that sort of outcome that you're hoping to get to at the end when you do have the lived experience voice driving care. And so there are 3 activities under this. So I know this looks a little bit full on, but the recommendation 4, the Citizen and Community Partnership, also known as CCP, that has now been really embedded in health networks, which has been really good for this piece of work. It's a really natural home for it. It took a little while, as this implementation was trying to be, mobilised, and there was COVID, there was all sorts of things going on. It's taken a little while for it to find a home, but now that it has, it's really starting to take some shape. And this is what it's starting to look like. So you can see here, like, for example, so basically the work naturally fits into these 4 things, enhance partnerships and capability, demonstrate partnerships in practice, transparent reporting, and citizen and community panel. So you can see that R4M15 and R4M9A8 and so forth, they all link into those recommendations and activities. So what you can sort of see there is, the different pieces of work happening underneath. So, for example, you can see under enhanced partnerships and capability, there's paid participation policy. That piece of work is progressing for health networks as we speak. Training and support, there's co-design training happening in September 2021. And so that the idea is to actually train people in the health system and consumers side by side. So that very early piece of work is starting to happen. So in that second one, demonstrate partnerships and practice, identifying pilot projects. It's something that we're thinking about right now, because the citizen and community partnership forums, we're planning to hold 2 of those each year, and the first one's coming up in October, as we'll talk about a little bit more later on. Again, a little bit of a busy slide, but just to try and sort of show you, everything has to find a home so that it all works within governance and so forth. And this is really all starting to take some shape. So you don't need to have that, but it's just in case you were interested in governance documents, there's one. I wanted to reflect a little bit on some of the things that have happened so far. So you may be aware the Mental Health Commission were doing a literature review at exactly at this time that things were taking place. And so instead of actually recommendation 4 doing its own literature review, we waited for this to come out. One of those key insights that's really stayed with us is that the method of engagement is not nearly as important as the relationships that are built. So sometimes having a focus on co-design can be, sometimes it can be counterproductive if there isn't actually the time to co-design. What can happen is people then think, oh, well, I'll just do a little bit of, little quick survey or something like that, rather than really trying to dig into as much of the collaboration as you can. One of the key points to note about that literature review done by the Mental Health Commission is there needed to be more peer and lived experience sources quoted in that. So that's just something to flag. Another thing that, you may be familiar with, this spectrum of engagement, that the Working Together Toolkit was co-designed by the Mental Health Commission. And you can see that there's that, it goes from consult to involve to co-design, co-produce and citizen-led. Now, it's interesting that as that piece of work was being done around the literature review in the Mental Health Commission, and also trying to make the Working Together Toolkit, which had been co-designed by consumers and family members, into something that health service providers, really felt that they could work with. It's actually tended that the next suite of documents created by the Mental Health Commission have kind of gone back to probably more what we all recognise from the international spectrum of public participation: inform, consult, involve, collaborate, empower. And that was in the sense that co-design, co-produce and citizen-led are in fact all kind of, sit in the collaborate and empower. What was sometimes reflected was that services who didn't really know how to co-design would fall back down to inform or consult. So there was just some reflections on work that's been happening in the last few months. The transparent reporting expansion of care opinion, just highlighting that we did actually interview here NHS Scotland's Jason Leach down the bottom, and to the right, Sean Marr. So NHS in Scotland, they have care opinion for their health and human services right across Scotland. So it's a little bit similar to WA in that, we have all our public hospitals on it. And it was a really interesting conversation about what it's really like to implement. I've actually put the link down to the page, the care opinion page on the Health Consumers Council website if you want to dig in and have a look. We are also putting out shorter videos around care opinion. So it's just one of those, that's a little bit of a piece of work that supported that. And we also did have conversations back in October of 2020, which does feel like a long time ago, but just wanted to reflect back some of those really key insights about, the importance of having brave, safe spaces for people to come and talk. And that really key idea that, our needs are, come across all sectors, and fundings and services might be siloed, but people's needs are not. And of course, that really important thing, we are never starting from scratch. I'm sure a lot of you are already doing really good work. So there's so much about Sustainable Health Review Recommendation 4, which is trying to bring stuff together and really, I guess, network and build that network and networks, network of networks about what's actually going on. Just wanted to highlight too, there's this piece of work happening around outcomes reporting for the whole of the Sustainable Health Review, all the way through getting the Sustainable Health Review report put together. The consumer and carer group was so strong about the importance of having outcomes that you can measure. These are some very early outcomes. This work is definitely a work in progress, but just, the goal is really at some point to have outcomes that we can see at a glance, a little bit like the closing the gap outcomes, how we're actually tracking across them. I just thought I'd include there what those fast track outcomes that have been decided on so far are there. And as mentioned, this PowerPoint is just for you to have a look at later on. I talked a bit about recommendation, about how recommendation 4 cuts across all recommendations and in the Sustainable Health Review. And I just wanted to give a quick whistle-stop tour of some of the work that's been happening around consumer and community partnerships. So recommendation 11 is around outpatients. Obviously, COVID really helped move outpatients along. And you can see here there's been some work done by the Consumer and Community Involvement Program and the Outpatient Reform Program to really do some community conversations. As soon as I get the report, I'll make sure that there's a link to that consumer report. The recommendation 13 is about frequent presenters to emergency department. There's, if you click on that link, it's an interactive newsletter. It sort of takes you through all the different things that they've done, like a consumer and clinician survey and so forth. There was a focus group held at Carers WA on Monday 9th of August that had a mixture of consumers and carers, which I was at. And then also this symposium, you can see Robert Blakeman did a wonderful job of starting off the session talking about the consumer voice around, COPD, chronic obstructive pulmonary disorder, and chronic heart failure. So it was a really interesting, so obviously that's only just happened, so the report will be coming out from that. The Health Consumers Council has been doing some work to support the Digital Health Recommendation 22. So we've been helping to co-design a consumer charter. So this consumer charter provides the underpinning principles for how we create an electronic medical record. So we use the kitchen table methodology where you push the conversations right out to community. And so you get that, as you can see, there's 74 consumers, 10 different discussions held, lots and lots of people across WA and all sorts of parts of society. We even had to translate some of the material so that people could actually have the community conversations. The recommendation 4 will be having a forum on the 22nd of October. And so we'll be showcasing these and other things. We'd love to have you along. And please do stay in touch. We have a website page, and we are, as I say, this is a really big and important piece of work, and it's only just begun.